Hey, listeners, we're excited to release a series of bonus episodes over the next several months that we were fortunate to record at Vive and HIMSS this year. These episodes will drop each Friday, and they'll get right to the heart of questions about innovations and digital trends that industry leaders are seeing. Today, you'll hear from Seliski from Allegheny Health Network and Franco Cardillo from MUSC. Let's get to it.
All right. Want to introduce yourselves?
Sure. Hey, good morning. Thanks for having us. Joey Seliski, part of the Digital Health Strategy and Operations team at Allegheny Health Network. Excited to be here.
Hey, I'm Franco Cardillo. I'm the Executive Director of Digital Strategy and Operations at the Medical University of South Carolina.
Fantastic. All right, guys. So you guys said you just met in person for the first time, but how have you gotten to know each other and kind of what's driving that? I understand like there's actually there's a lot behind that.
We're excited to always network with the other health system leaders across the country to really learn like the same problem how we're trying to solve and helping patients be healthier through technology. And I think we can learn best from other health systems and how they're thinking about it, and how can we also implement those lessons learned. So I think we naturally met, and through that, still meet monthly to brainstorm ideas and products that we're looking at.
Yeah, and just to follow up on that, right? The conferences really allow us to meet with, as Joey said, leaders across the country. But what it does is kind of create these additional forums that we meet outside of conference season that product agnostic. We're talking about the implementation. So it's funny because you're right. We just met this week, but we've probably had a friendship for the last year or so, just talking about what we're doing. And Joey and I have very similar roles currently, but our backgrounds, don't. They start in different positions, right? He's more of a technical guy. I'm more of an operations revenue cycle professional. But it's so interesting that through our different implementations and learnings, we just have a lot of similarities with what we're doing, and everything right now is patient access centric. So we can share a lot on that topic. But that's also what we've been doing. We've created forums outside of this that have multi-health systems, participating in that. I mean, we've got 12 to 15 members join monthly, essentially sharing information that we didn't know each other 6 months ago. So really creating that forum has really driven the friendship and the relationship.
So give me some examples of some of the things y'all talk about, without naming names or whatever, but is it more on the change management side? Is it like, hey, what's your experience with this vendor? Like what are some of the things y'all talk about?
Sure. Yeah, no, I think it's both aspects of that, Jared. So we talk about at the start, hey, are you looking to solve this same problem that we're looking at our executive level? And if it's the same, then we say, great, like what's your click down then into that? Like what products do you look at are you implementing? Have you hit the expected return or the product work that you would have anticipated? And then also the side of how did you implement it? How did your operators receive that technology, and how should we be looking to also implement similar processes so that we can also learn faster and see the value across all health systems in a faster way and not hit the same roadblocks that other systems may have seen.
So we all agreed and we come prepared with topics to discuss because we're all trying to understand each other's portfolio. So by being prepared, we can go into a meeting with, are we talking about change management today? Or a heavy topic has been the virtual assistant implementation and how that could help reduce call volumes to our call center. So we go into with themes. We all have different IT setups, right? We all have different, EMRs that we're using, and it's just how those are implemented impact the install and the deployment of what we're all talking about. So it's so different, even though we're talking about some of the same products. It's kind of your homegrown technology and how that supports you trying to bolt on.
All right, so let's talk about some things that you guys have been either like focusing on or able to celebrate, team accomplishments, team recognitions lately. Just what are some of the things you've been able to celebrate lately? Joey, you want to start with you?
Yeah. So at Allegheny Health, some of the big things we're excited by is our ambient listening rollout in the clinical space and hospital space. We're excited about where we're going with our digital nursing infrastructure, virtual platform. I think too, to your point on just shout outs to our team, like the team back at Allegheny, we're thinking about how do you ensure digital product success. I think, and what I mean by that is we have folks that are product owners of these new platforms and really partner with operations to ensure adoption is there. I think, which I really appreciate. It's a new arm of our organization we're starting to stand up and push towards, but I think it's important as we keep rolling out more digital products to help our patients, we need to put a focus on it. The medical record is a big platform, but it's not everything, so we're putting a focus on what are our other top 10 strategic platforms and having a team day to day just overseeing them. So excited by that.
I think for us, just who we celebrate is really every partner that comes along with us on their journey of installing something new. So whether that's a virtual assistant in our patient access center, we know that the testing that we ask of them and the subject matter expertise that we're kind of extracting from them takes time and it takes hours away from what they're currently doing. So we like to make sure that those folks know that they are really just like the rock stars in all of this, and we're just here to help support them on this journey of just taking what they thought was a good process and then bettering it with technology that we're trying to layer on. I always see ourselves as the group that kind of walks alongside them really never takes the credit because they're doing it. If I can just come along to the journey and say, hey, I helped you kind of see a different vision here, then we're all for that. And I will say at our organization, we have a lot of leaders who are interested and I think there's a lot of preconceived notions that people are pushing back on technology or they don't want it. We've got a lot of leaders internally who are coming to us, getting them on board to do what we're doing, effective change management. But again, it's been easy. When they need technology, they know they come to our teams. Revenue cycle. I've never had a chief revenue cycle officer like Jim Perry at the Medical University of South Carolina who was so excited about technology, right? And he wants to automate as much as he can. And in an effort to get his teams to work, the top of their degrees, right? And it's never about who we're cutting. It's about how many positions we may not have to hire as a result, right? We never talk about the elimination of positions. We talk about the current team kind of elevating their current skill set. So we have leaders who see that vision and want to really uphold that. So I can't say enough about the teams around. I mean, population health, clinically, like we have so many different groups who I can celebrate, but I'm really proud of our patient access and our revenue cycle work currently. And I'm just excited to see where some of our clinical focus, takes us ahead.
Well, that's so okay. So you all mentioned like the tech side, kind of the change management side. What if I dive into that side for a second, just process-wise? So say there's an initiative that you understand, like you feel like, okay, I'm ready to champion this. Like it is a little less of a request, or meeting a request from another team or something behind the scenes. You're like, okay, I get like this is something we need to do. Like how does that work? How does the change management process work when it is something being initiated by your team as opposed to like being requested?
Yeah. I think it's all about being upfront about the end state that we're trying to achieve and just laying out, look, 5 years from now, here's what, if we do this technology, what the workflow or impact to our patient or the operator could be. Like here's where we are today, and I think if we look 5 years ahead with this tech, this is how we could enable it. And by just telling that story, look, if we start to slowly work at that as a collective team, like you all know the operations best. My role in digital, to Franco's point, like we're here to orchestrate and say, these are what other health systems across the country are doing to solve this. Now let's talk through with you all and say, is it possible or not with the setup we have, and operationally, how do we move towards that? So that's what we always start though. Where do we want to be in 5 years, and then work back from that?
I think I was just having a conversation with somebody about this yesterday. It's becoming that there's a lot of technology out there, and so which one do you select? But it's becoming a lot on, for example, myself, right? My name and my brand is either going to hurt or help, right? The installation of something. So if I go to a patient access leader and they know that we've done an installation previously and it was successful, they're more inclined to trust me and believe that we can do this again. Versus, like, to Joey's point, if I go into something and just say we're doing this for the reason of, like, this is going to be a great scheduling software, that goes over, like, terribly. If you don't lead with the why, you don't actually help it, people will understand that, listen, you're fielding 75 calls a day. We can help you reduce that to 43, and here's how we're going to do it. Here's the benefit to you. We just need a little bit of time and effort from you to implement this. Tell us about your feelings. Tell us everything you're concerned about, right? Everything that you own today. And help us help you understand that it's going to be okay. But that's where the relationship building matters so much more. I mean, we talk about change management, but like part of change management is really building relationships so that you know at the end of the day that I'm going to be with you during this implementation. If something breaks, I'm going to be with you to fix it. So I think it's really the relationship piece helps kind of enable the change management and really fosters that effective relationship getting some of this stuff done.
I think something that, frankly, you're getting into that I always say is trust. I mean, trust is key in developing that relationship from the very start. To your point, if you have that, I think they then listen to you a little bit more and sort of are willing to change a little bit and trial something. Because again, you have that already established. I think for us too, like we're excited by looking ahead, like a big change we're thinking about specifically in the call center is patients calling in and wanting help with something. And older IVR technology was press 1 to do this, press 2 to do this, and our patients were the ones being hurt by that. So like us now shifting towards a future of more conversational based, conversation on the phone allows our patients now get the answers they need faster, and our operators will also be hopefully fielding the calls that they should be and not receiving these questions that maybe voice agent or conversation could help with. So that's a big focus for us too, and again, it always goes back to the patient at the end of the day. I think if we can tell a story like that, it's a win.
All right, last question. So since the podcast tends to be themed on how to make healthcare more consumer-centered, that's what we've been talking about for years. And sometimes that's more on the partnership side. Sometimes it is more on the traditional care side. What do you personally hope you see in healthcare to make it more consumer centered? Like, what would you like to see? Like, if you get kind of grant a wish and say, like, here's an aspect of healthcare that can make more about the person who are helping be more healthy in general. What do you think? Like, what's something that you hope we could do?
I think we have to move away from sick care to more preventative care. I mean, that's a loaded conversation, but just how do we ultimately help our patients get to maybe avoid going to the ED, when they could have maybe had a virtual visit, have the ability to have a physical therapy remote appointment from their home and not need to come to our facility. That's what leads to the more costs and the bad experience for our patients. So if we can help them at their home sooner in well care, I think that's the end state we're trying to get towards. Like, hospital should only be for truly when a patient needs that surgery or is so sick they can't care for themselves at home.
As you asked that question, I mean, my head went in a million different places. I would hope, right, we're at this conference right now, and as I'm walking the showroom floor, I see, a number of like ambient technologies for providers. And I think that technology is game changing. But for me, I wish that someday health systems will sit down, right? And what a novel concept, let's prioritize patient experience and saying, whatever your homegrown EMR is, right? Like, let's have a strategic conversation about what things can bolt onto that or make the patient's lives easier. I feel like we have a lot of churn in organizations right now, a lot of digital capabilities, shiny toy syndrome, where we see these things out there. And with our EMR setup, is it productive for us to look at a solution, right? I just think there's so many solutions right now, and I think health systems are all over the place. I just think we need one central strategy to say, what are we looking at? Is another group in our health system focusing on this? We don't want to duplicate. But then just taking it a step further, right, there's two things that I think that I see in the two previous health systems I've been at are nursing is never included as part of like the patient experience. They have some of the most touches within the hospital of a patient, though anytime you talk about clinical tools or application, you talk about the front end ops, you talk about the physician and how we can make their lives easier. There's never really a heavy conversation about the nurses in that world. And then just one other thing I've seen is the oncology space. The patient journey in the oncology space can have, you touching, one patient asking 90 questions to 18 people a day. One centralized journey for those patients. So it's like, I know we have all these point solutions and we're trying to make everything seamless and cohesive, but there are certain service lines within health systems that need a little bit more of a dedicated focus, because patients might need a little bit more in that world than needed in primary care, or they might need it in, cosmetic dermatology, right? So I think that there are some areas to focus on, but that's why coming to these conferences you get excited, right? Because you see a lot of people working on a lot of really cool things that could really implement. I just think from the other side, health systems need to have more of an internal dialogue and conversation about the tools and the things that are out there. Because at the end of the day, as Joey said, like, the patient's there. We have all these ideas, but are we making assumptions that the patients will like what we're doing? And we have to get that feedback, and it's a two-way street. So
Yeah, one more thing quick. One thing I thought of while you were talking too is we have to recognize not all patients are pro-digital as well. It sounds crazy, but I think we always are thinking that every patient has an iPhone. Every patient's going to be able to do self-service registration. We need to know our clientele of who we're serving, and I know in Western Pennsylvania we focus on this patient needs a phone call. And maybe it has to be human because they don't trust an automated phone call, so we need pathways to still get the live interactions. We always say digital is the future. I think there's going to be a physical and digital ecosystem we have to be designing. So your comment made me think of that. I think we sometimes come to these conferences only think solve for all these digital, but we also need those that aren't. So,
Guys, well, I'm glad we were able to capture your first meeting here and share so much to think about. Thanks a lot.
Yep.